Hi, my name is Matthew Fox. I'm an associate professor of nursing on the Ohio University Zanesville campus, and I'm going to be talking to you very briefly about a medical mission trip I participated on in Mexico. So, on this short term medical mission trip, we provided free medical care to individuals in the cities of Rio Bravo, Nuevo Progreso, and also Reynosa. I, as a registered nurse, worked along with other registered nurses and medical doctors and nurse practitioners to provide this free medical care. I learned numerous lessons on this trip, too numerous to mention in this very short talk, but I will mention a couple of them that I myself try to think about on a daily basis and also try to incorporate and teach my nursing students that are taking my classes. So the very first lesson that I learned is just how fortunate I am to live in the United States and to have easy access to healthcare. And that is true for many of us that are living in the United States, that we do have easy access to top quality healthcare, where in comparison to other countries around the world, that is not the case, such as the case in the areas that I spent time in Mexico. And just thinking about that, I found it very eye-opening that the basic medical care that we were able to provide to these individuals, they were extremely grateful for. They were receptive to everything that we were teaching them about health promotion and about whatever disease or problem that they had come in with for the day. They were very receptive to that, and they were very open to us and our medical expertise. There was some challenges on this trip. So the one challenge that I'll mention is the language barrier. So we were provided with translators who did help overcome this challenge, but that was what's the primary challenge of not necessarily being able to fully connect to our patients that did not speak English. So that was the main challenge, but definitely the positive aspects of this trip definitely outnumbered the challenges that I encountered. On the very last day of the mission trip, we were based in a refugee camp, providing just that same basic medical care. We would see patients based on their whatever complaint or problem that they had for the day, or whatever medical issue that they were presenting with. And we would also talk with them or they would usually open up to us about their experience in the refugee camp and where their home was and where they had traveled from and how they had gotten there. And that was another very eye-opening experience. Especially, I do remember very vividly caring for a patient who had scars on his wrist from being held hostage. He was bound by his feet and his hands in the jungle for weeks before he was able to escape and eventually make it to the refugee camp on the border of Mexico and the United States. So that prompted a very visceral feeling, having seen that and touched those scars, and that is one of the most vivid encounters that I remember from this mission trip. Other lessons that I learned that I try to instill into my nursing students taking my nursing courses is to be patient and kind to all of those that you encounter who have different beliefs, different cultural backgrounds, different cultural values that you have, and that we should be respectful of each other's opinions. And then also help when you're able to. So help others, whether it's in this country, whether you're presented with opportunities to go to travel abroad, on mission trips of any kind. Definitely take that opportunity and do it, because it is well worth it. And I do plan on going back to Mexico once the COVID-19 restrictions are lifted, And once again, I just encourage all of you to be kind, be respectful to those who are different cultural backgrounds than you, and also help when you're able.